The hub at Maidstone Hospital is based in the visitors car park just opposite the oncology centre. So you enter the hospital grounds and turn left at the mini roundabout and then proceed up, and you will see the 4 cabins on your left hand side. If you proceed in your car past there, the staff car parking will be in the corner car park, which you can see at the far end to the right side.
Hello, I'm Claire Cochran-Dart. I'm a GP in Larkfield and the Morling Primary Care Network Clinical Director. So I just want to tell you a bit about the Maidstone Hub. So I think I've already explained that we're based in the end of the visitor car park up near the oncology centre at Maidstone Hospital. When you arrive, somebody will let you into the staff car park so that you can park. That's the one right at the end next to the nursery. You'll find that there's 4 cabins. One is going to be used as the hub clinical assessment room. One will be used for the virtual COVID ward, another for changing, and the last one will be our accessible cabin having a ramp. Within the COVID hub cabin, you'll find an examination couch, a desk, a laptop, and a file with all the guidelines and pro formas that you might need for your shift. We're also going to laminate the referral process and the assessment guidance and put that on the wall so it's in clear and easy view. If you need to use the facilities while you're here, then you can use those in the oncology centre opposite. You will need to be temperature checked, but the staff are aware that GPs will be coming in and out during the day as necessary. If you have an emergency, we will have a defibrillator here and some oxygen, but you can also go into the oncology centre and dial 222 to summon the crash team. We are advising you to wear scrubs, so you can use the changing cabin to change into your scrubs when you get here and then change out of them when you leave, and we will provide bags for you to take those home with you to wash at a high temperature. The reception staff will arrange for patients to come to the hospital to be seen, but they will only be invited to the assessment area when you're ready for them to be seen, and the healthcare assistant will take all the observations ahead of this. So you will be able to use Vision Anywhere to gather the history from their own GP, couple that with the observations, and call them on their mobile phone if you require any further information. If that's not sufficient to make a decision in terms of your management plan and you would like to examine them, then you're welcome to bring them into the cabin and carry out an examination. They will be given PPE and you will obviously have access to all the PPE that you need within the cabin. The surfaces will need to be wiped down afterwards, and the cabins are thoroughly cleaned every day.
Initial observations will be taken with the patient in the car. The observations will then be delivered to the GP, who can make a decision whether the patient needs to be seen face to face for a more extensive examination. If they are considered to require an examination, then the patient will get out of the car and be instructed to proceed around to the front side of the assessment cabin. If there is a doubt about oxygen concentration, the patient can be asked to do a 40 step, walk, and before and after pulse oximetry taken, if there is more than a 3% drop, then admission will be considered.